So in my research talk, I'm going to talk about the health and psychosocial ills of American prison inmates, much in the same way that Dr. Nemes was focusing on women inmates and using retrospective designs to explore what happened to their early childhood and adolescence. So the question we're asking is what childhood and adolescence can tell us about community reentry under the Second Chance Act. So as we've learned from Ms. Kane, the 2008 Second Chance Act facilitates the productive return of inmates to their families and to their communities. This is accomplished usually through improved programming and increased access to services that have typically gone ungiven or undergiven. These are to both the inmates and to the children of the incarcerated. So disadvantaged, high-risk health, social, and substance abuse behaviors are often pointed to as the most relevant primary causes of the negative outcomes we observe in the inmate and the juvenile justice population. And as such, those tend to be the focus of all of our intervention in our programming. So today we're pondering sort of a different issue and maybe a slightly different lens. We're considering whether programming and intervention supported by the Second Chance Act can be better calibrated for justice facility practitioners and community providers by accounting for the full life course factors concerning the long-term and intergenerational collateral consequences for the youth and the adults that they serve. So in many ways, this study model is very similar to what was presented by Dr. Nemes. So I've already mentioned earlier, our questions have shifted significantly over time. Won't repeat this territory right now, but we've moved from the point where kids are very small people and act as such to considering a broad spectrum of related outcomes and considering a life course perspective about children's behavior. So thanks to people like John Lobb and Robert Sampson in the 1990s, which is a wild and crazy era for research in justice, we now have a much more life course perspective. And so as we've started our understanding and our research in justice and adult criminal fields, we really only focused on two populations, those who were adolescents and those who were adult criminals. And we often overlooked the other major developmental stages in life. We moved from there to considering early childhood and the cognitive deficits that occurred to children who were underserved, who had inconsistent parenting, and who had poor nutrition, among other factors. We moved even further back to infancy and prenatal care in considering what causes poor outcomes among children and adult offenders. And as Dr. Kinner has noticed, we have a new appreciation of the very critical importance of early adulthood on outcomes for criminal justice and for juvenile justice. We also see in our research that we have a broad host of outcomes today. This slide simply illustrates that in the past, we considered crime as a single outcome of interest. You can see that as that one little green spot. Over time, you can see that through the decades and the actually century, we've moved from considering crime as the main outcome to considering individuals' health, mental health, and substance abusing status to how they're doing in terms of their parenting and family and the well-being of their offspring, their own victimization, and the trauma and victimization their own children see. We also consider different domains. So as Leah noticed, there are many domains in which the Second Chance Act is operating. We consider community stability, we consider the school, we consider workforce, housing, and service delivery utilization. Pardon me, let me go back for 1 minute. We also notice that across all these domains, there's a single underlying theme, which the literature in the 90s began to really emphasize, and especially in most recent years, which are the collateral consequences of imprisonment. These permeate every aspect of the individual's lives, whether they're the inmate, the juvenile, the child of an inmate, the family member, the community member. So negative outcomes spring just from a single person all the way through these domains. So today, the focus we're going to take does take this lifetime focus. We don't have data on the infancy period, but it focuses on planning for outcomes for reentry and planning for care for adolescents who are in the juvenile system. So this research is inspired by the commitment to the reentry program and all that it entails. It's an inclusive retrospective life study, and the focus is on key risk factors at each developmental stage, and in particular, incarceration. So let me review the model just a moment. We take a life course perspective, mine is infancy, unfortunately. We have measures across the life course in terms of disadvantage, lack of prevention and intervention services, and like you've heard before, we also include measures of early childhood neglect and other measures of family disadvantage. What we're mostly interested here is a simple question about collateral consequences. And I put here, what are the effects of familial incarceration during early adolescence and childhood on outcomes for adult inmates? So we're looking at a sample of adult inmates, both young adult and older adult inmates, and we're wondering how these factors influence the health status, the substance abuse status, and the mental health status, with the outcome being, the goal, being guiding reentry policies. We have a very simple data source. It comes from the Bureau of Justice Statistics. It's a survey of inmates in state correctional facilities, about 14,000 cases, about 1,500 institutions. So I am going to skip that slide and move over here, and instead of having you read each effect size, I'm going to just summarize it for you and allow you to look at it later. What this slide tells us is controlling for all those factors that I showed you in the model, and that includes numerous measures across the life course, and controlling for disadvantage and young childhood neglect. We find that disadvantage and risky behavior are definitely related to health outcomes, but what we find are equal, if not stronger, effects for early childhood familial incarceration. So we're finding an effect for the young people who have had parents who are incarcerated on their long-term health outcomes. These findings remain very stable across the other outcomes of mental health and substance abuse. So in the past, we may have taken a simpler view about the causes of the poor status of inmate health. This is a little bit dispelled in this case. We've considered that risky behavior alone isn't good enough in explaining why we see such poor outcomes. Disadvantage isn't good enough to explain poor outcomes. It is oftentimes the collateral consequences of familial incarceration of these young and older adults from their early childhood. So what does that mean to us? So this study is focused, on planning for outcomes for reentry and for planning care for adolescents in the juvenile system. And I am going to move on to my conclusions without a slide. So the health-related aspects of the Second Chance Act will be more effective for released inmates, for their offspring, and the communities to which they return, only, we believe, when the interplay between complex risk factors and intergenerational influences are considered more carefully. So in planning and practice, what does that mean? It means that those with histories of familial incarceration may be the most in need of our services, regardless of whether they have current or past risky behaviors, whether they're health-related behaviors, substance-abusing behaviors, or just high-risk, low self-control behaviors. Finally, it also suggests that the youth of the incarcerated, so these young children who are left at home while their parents serve time, may be differentiated from other at-risk youth in terms of potential outcomes at an early age. So in summary, we find a very strong influence of familial incarceration on long-term outcomes, and we encourage those who are working, especially within the Second Chance Act, to consider how familial incarceration affects reentry programming and what services we provide to these people and to their children. Thank you very much.